In 2009, when this law was being debated, pretty much everyone agreed that this country had a problem. There were way too many uninsured people. By some counts, 49 million uninsured Americans. So everyone agreed something had to be done, but everyone disagreed about what had to be done. What Obama came up with is a rule that says everyone has to have insurance, and you can get it through your employer, you can get it through the private market, you can get it in a variety of ways, but everyone has to have insurance. When people don't have insurance, well, they're really in a terrible pickle when they get sick. I mean, imagine you don't have insurance and God forbid you get hit by a car or you get cancer. How are you going to pay for that? Not only are you in trouble, but the rest of us are in trouble, because if you don't have insurance and you get hit by a car, the rest of us are paying for you to get care. It comes out of our tax money, it comes out of our insurance premiums. We all end up taking care of the uninsured. The health care plan was passed 2 years ago, and it's implemented in a series of stages. Some things happen very quickly, and other parts of it don't happen for a couple of years. Health care reform has already made it illegal for insurance companies to say no to a child with a pre-existing condition. Before health care reform, insurance companies would often tell children with pre-existing conditions, no, sorry, we don't want to insure you, because it's expensive to insure someone who already has a serious condition. Insurance companies have already been told no more lifetime limits on benefits. What used to happen is that insurance companies would say, you have, let's say, $5 million of benefits, and that's it. And when you hit that $5 million cap, you can't have any more care. Healthcare reform law said you can't do that anymore. There are no more lifetime limits. Now, most people never even meet this cap, but if you've got a serious illness, you can actually meet a $5 million cap relatively easily. Healthcare reform also allows children to stay on their parents' insurance until they're 26. One of the things that will happen in the future because of healthcare reform is insurance companies will have to accept adults with pre-existing conditions. They can't say no to you just because, let's say, you have asthma or you have cancer or heart disease. So in 2016, you'll have to buy health care insurance. It'll cost about $5,000 for an individual, $12,500 for a family. And this is the most basic insurance. You can also spend more money and get, fancier insurance that gives you more coverage. So if you don't buy health insurance, you are going to have to pay a fine. That fine is approximately $350 for a child and $700 for an adult. So for a family of four, that could be about $2,000. So this law says everyone has to have health insurance, and let's face it, we all know that health insurance is expensive. So what the law does is, one, it allows more people to receive Medicaid, which is the federal program for health care insurance for people who can't afford it. And if you don't qualify for Medicaid, you can still get subsidies from the government to help you pay for insurance.